We are Compass Medical Center, and my name is Dr. Justin Woodside. I'm a chiropractor at Compass Medical Center, and today I'm going to be talking about diabetes. So, super excited to share with you the information we have about how to help patients with this horrible condition. So, let's jump right in. First of all, want you to know and understand we have a new way of treating diabetes, and we're going to cover exactly what that is. If you have questions, don't hesitate to call us at the office. Don't hesitate to get the info that you need. But this is truly a new revolutionary treatment. So first, I'm going to cover conventional treatment limitations. So basically, these studies here, guys, teach us that patients and the normal conventional treatments that they're doing right now, like diabetic medications, you can see on this chart, you're able to see my cursor on this. You can see that even though patients maybe see an initial dip, normally their A1C continues to rise even though medications have an initial effect, right? The longer they take those medications, the worse that they work, basically, right? And so we just don't see effects that are lasting long term, and obviously that's bad for the patient. We know that when your glucose is high on a consistent basis, it destroys the tissues in our body in a negative way. And tightly controlling glycemic index doesn't reduce the cardiovascular mortality rate of diabetics either. So a lot of the side effects that diabetics incur, they really don't change even when they're taking these medications. They still have the same side effects and risk factors from the diabetes. So it's really unfortunate that these limitations are there, because ultimately it just means the medications people are taking aren't really working as well as they would hope. Next is this picture. This depicts what's supposed to happen in our body, guys. So when we look at this and we see, let's say, the glucose release here, let's do this first. So the glucose comes up because we've eaten or because there's been a glycogen release in the liver. That gets our blood glucose to be high, and that signals our body to secrete insulin, right? And normally that would mean that when insulin is secreted, that glucose uptake happens, and that glucose uptake is going to lower our blood sugar and ultimately drive glucose into the cell. That's what this little blue picture is right here. And our next slide, we're going to cover that even a little bit deeper. So that's what normally should be happening to get glucose into our nerves, muscles, connective tissue, epithelial tissue, and all the other tissues in our body so that they can be healthy. Remember, your blood glucose is high. That means it's not getting into the tissues like it's supposed to be, right? So next is this picture that explains that very thing. So this is a patient with a normal functioning glucose uptake. They're using insulin properly and that sort of thing. So when we look at glucagon and insulin, there should be a rotation or a spike of each of those about every 4 to 8 minutes in the patient, right? Now, we all know that insulin is a signaler for the cell. So these little insulin triangles here, this is just an artist picture, obviously. When those attach to the cell, that tells the cell to let glucose in, right? The little green dots. And that's what's supposed to happen with normal physiology, right? In a normal patient. Patient who has abnormal physiology or diabetes, they are not regulating insulin and glucagon like they're supposed to. And we have a very unhappy cell because insulin is present, glucose is present, but it's not attaching to the cell, and the glucose is not getting into the cell. So that's a bad thing. That means that the cells are very unhappy. And ultimately, we have a term for this. This is called insulin resistance, meaning the cell is not using insulin, or it's not attaching insulin, which means glucose is not getting in. So what our treatment does is we use a very special IV therapy that mimics the body's insulin regulation, and that's what these purple lines are. And ultimately, what's going to happen there is we're going to have glucose going into the cell because insulin's actually attaching. So we basically come along and say, hey, we're going to cause this reaction of insulin attaching to the cell to happen, to this unhappy cell. The cell becomes happy because when insulin attaches, it opens up and glucose goes in, right? And so that's what we want to mimic here. And it is an amazing thing the way it makes a patient feel when we do this treatment. So next question is, what does treatment look like? First, I'm going to cover the elephant in the room. Everybody wants to know, is this treatment covered by my insurance? And the answer is yes. Treatment is covered by most insurance, including Medicare, commercial insurance, and often Medicaid. We will verify your insurance coverage and benefits as part of our process. And then we have a basic initial exam. We get some updated labs. And then our initial treatment plan is typically 12 weeks. And we're going to see you 1 to 2 times a week in the beginning, depending on the severity of the patient. And then go down to once a week after, or 2 times a week. So let's give an example here. It's what I've written up. 2 times per week for 4 weeks, and then once a week for 8 weeks. So over the course of a 12-week treatment plan, you would have been seen a total of 16 times. Our treatment time is 3 hours per IV infusion. Remember, if we go back to our last slide, we're trying to change your physiology here, get it back to being non-insulin resistant. If we're going to do that, it takes some time and repetition to retrain these cells what to do, right? So we do a morning session and an afternoon session. So who do we treat? We treat patients who are type 2 diabetic, type 1 diabetic, pre-diabetics, or those who have metabolic syndrome. So we would be looking for and trying to find one of those diagnoses and understanding you as a patient to be able to treat you and to bill this to your insurance. After an initial 12 weeks of treatment, patient is reevaluated and new labs are taken. Our goal with patients is to get you down to 1 to 2 times a month with treatment. And sometimes it's going to be once a week. It's going to depend on the patient. It's going to depend on the severity of the diabetes and the response to their treatment. I will tell you this, patients absolutely love getting treated and they love the way they feel because of their treatment. This is something that typically within a short period of starting treatment, patients say, wow, I'm feeling so much better. I have more energy. I'm sleeping better at night. All these different responses that they're not used to, and they start to feel better and start to see improvement in their numbers as their treatment progresses. So we often talk to patients about stopping the effects of diabetes, right? It's very rare that you have a patient who would have a diagnosis and say, I actually died from diabetes itself. But what people die from is the complications of diabetes, like neuropathy, kidney problems, high blood pressure, weight gain. They have high A1Cs, and they don't die from this, but it is a symptom. Medication side effects, dementia, Alzheimer's, retinopathy. So people's eyes start to go really bad. So there's just so many negative side effects, like liver problems and kidney problems is a huge one. Most patients who are on dialysis, unfortunately, they started out having a diabetic issue. So the cool thing about our treatment is we actually see change and typically reversal or improvement of these problems, which a lot of doctors would actually tell you that's impossible, right? The medical world would say we can't change these things. We can just manage the symptoms. But we actually see people say, my neuropathy is actually getting better. My kidney function is actually improving. And we're going to show you some studies here that will show you that as well. So treatment is simple. You get comfortable. Basically, you sit down in a recliner. We have a TV going typically, and then we just go ahead and get started treating. And everything's good to go. You get hooked up to your IV. You're monitored throughout the treatment to make sure you're kept safe. And it's amazing. Patients love coming. They get to know other patients and they really enjoy their treatment. So again, what is the treatment? Just so you see, this is what a pump might look like. And basically we take that pump and and we slowly apply these microdoses of insulin that are going to change the way your body responds to insulin, right? So we're changing that physiology. We're getting the body back to functioning normally and doing what it's supposed to. Okay. So these are some before and after cases. These are showing wounds and like hair and things like that. So, people have problems with their hair falling out when they're diabetic from time to time. So patients will actually see improvement in their tissues and their skin. Look at this wound here, bottom left. This is a wound with a patient, and this is 48 days, 5 infusions later. Look how much better their wound is, right? And the reason is we're actually helping that blood sugar to improve, and we're actually driving blood flow to these areas with the treatment as well. It's just an amazing thing that happened. Look at this. This is 23 days later with a wound. This is 49 days later with a wound. Obviously, the toe couldn't be saved, but you can see how red and inflamed this one is, and how this one is actually healing up. Same with this one, that red inflammation. Look how much better it looks. So we do see actual changes with patients with these types of treatments. So there is research that proves that this treatment works. It's not, you don't have to take our word for it. Not only is there decreases in hemoglobin A1C seen, but there is also reversals of kidney issues, halting the progression of kidney issues, reversals of diabetic neuropathy, improvements in wound healing, decreases in insulin requirements. That's a big one. We want to see people have to take less insulin because their body's using insulin better, right? We've retrained those cells to use it how it's supposed to. Again, improvements in kidney functions, the GFR, decreases in blood pressure. We see that with almost all patients. If they have blood pressure issues, we see that come down, and we already talked about improvements in neuropathy. So all amazing things for diabetic patients that, despite the fact that a patient might tell us, yeah, I'm taking medication, I'm doing everything my doctor told me, and my numbers have actually improved, but did any of these other factors that we're looking at all right here, did any of those improve? And majority of the time, by far and away, patients say, no, nothing has improved, just my numbers, right? So we see major improvements in patients' symptoms and the way they feel. So, and their actual lab values too. So one thing I want to cover is just taking action. What are the consequences if nothing changes? What happens if nothing changes? And there's a saying out there, it goes like this: if nothing changes, nothing changes. So that's obviously not what we want. If left untreated, this is literally a quote, just so you know, exactly from Google. I was trying to highlight that, but I guess I can't when I'm on a PowerPoint. If left untreated, diabetes can lead to devastating complications such as heart disease, nerve damage, blindness, kidney failure, and amputations. The risk of death for adults with diabetes is 50% higher than for those without, right? And we're not talking about just untreated with medications. We're talking about actually improving your condition, right? So you have to change something if you want change, right? And our program does that for diabetic patients. We thank you for your time. We're passionate about improving the life of diabetics. At this point, I would take questions, but I'm going to go to my next slide and show you that we do have 4 different locations. We have Compass Medical, Grand Junction, Montrose, Snowflake, and then in Arizona, we have Snowflake, and in Surprise, Arizona as well, Array Medical Center. But I'm going to take a moment, and I'm going to pop out of this presentation. And we have a patient who has been treating and seen amazing results. And so we're going to let her go ahead and tell us about that. If you would, please take it away, Doreen.
Thank you. Yeah, I started this treatment back in July, and my triglycerides were outrageous. My blood pressure was high. I had I was falling apart. And on top of that, my diabetes wasn't that good into control. So since I've been doing it, I've my blood sugars have gone down 50 points on my fasting blood sugars.
Wow.
Um, my kidney function has improved. My triglycerides have dropped to less than half of what they were.
Wow.
My LDL and HDL have gone down, and my blood pressure now is usually under 120 over 75 when I go in. So
Wow.
just overall, plus I've got more energy, and it's been a godsend. It's just been wonderful.
Awesome. That is great to hear. It how do you feel right now versus how you felt in July? Like on a daily basis, do you feel more alive? Do you do more activity? Like how has your life changed in that
Well,
period of time?
I have had the energy to do stuff that I needed to do before, like housework and mowing the lawn and just doing things going to help with my granddaughter.
Awesome.
Um, and just the energy part has been awesome. And plus my neuropathy has gotten better. Every once in a while I'll get this pain and it's like, what in the world? And then it's like, oh yeah, I have feeling in my feet again. And
Yeah.
so it's, when you don't have it, you don't miss it, but you just step on things and don't realize it. But when now I'll get a pain and it's like, how'd that happen? But it's been nice. It's been just really a change. I've had
Oh,
more
that's
energy
amazing.
starting a new career. So
Yeah. That is awesome. What's the new career? I'm curious.
I'm going from hospice nursing to life insurance and health insurance.
Cool.
If
That's
you're going to make
awesome.
a change, make a big one.
Make it big. That's right. That's right. Well, we appreciate your time and we appreciate your results and just how this has changed your life and taking the time to do that. And we will definitely be sharing this with a lot of patients who can also benefit. So, guys, like I said, change your diabetes, change your life, right? Like truly, this can be an absolutely life-changing treatment. Um, if you will just give it a chance, right? I mean, I think
Yeah.
Doreen would be the first to tell us, like, this still took work, right? She had to come in and she had to get treated, but it's very worth it. So
Yeah. It has definitely been worth every bit of the time I've spent doing it.
perfect.
So
All right. Well, unless we have other questions from anybody, I can pull that slide back up real quick, just as an ending note here that, well, let's see, I better share my screen first. So, um, that has the contact information. But beyond that, I think if we don't have any other questions, we'll close it up. So thanks again, Doreen.
thank you.
So yeah, you bet. Let me diabetes change your life. Give us a call if you're watching this. Um, we will get you in and see if you're a good candidate for this treatment. And we appreciate your time and look forward to seeing you and making a change for you. Thank you. Have a great night. Bye bye.